Nitong nakaraang 3 buwan, nangyari po ba kahit minsan na ang inyong pamilya ay nakaranas ng gutom at wala kayong makain? Nangyari po ba yan minsan lang, mga ilang beses, madalas o palagi? I am from the Ateneo Center for Educational Development, more commonly known as ACE. This center was established 23 years ago to spearhead the university's efforts to help improve public basic education in the country in scale. ACE started with training for school leaders and teachers to address the poor performance of students. However, we noted that several rounds of teacher training did not really make much of a difference in the larger sense. ACE then shifted from concentrating on training programs to an approach that considered other factors affecting the performance of students in public schools. For example, students who could not read according to their age level or did poorly in their lessons actually had poor eyesight. So ACE provided eyeglasses. Toothache was a big cause of frequent absenteeism, so ACE conducted dental missions. Instructional materials were not sufficiently available, so ACE initiated the preparation of teaching guides and workbooks. ACE started paying close attention to the problem of hunger and malnutrition among public school children 10 years ago. Stories we encountered in the process of working with public schools were instrumental and made hunger and malnutrition deeply personal to us. 2 stories stand out. In one elementary school in Parañaque City, the teachers told us that one day a grade 2 student fainted. Fainting among public school children is not very uncommon, unlike perhaps in private schools where as soon as a student faints, the child is brought to the school clinic as quickly as possible. The teacher attended to this grade 2 boy who fainted. Nung nahimasmasan yung bata, the boy said, "Ay, Huwebes po pala ngayon." He went on to say that on Thursdays, it was his turn in the family to skip meals so that his siblings may have the food. On another occasion, we were having a focused group discussion with parents in one elementary school in Quezon City, and it was brought up that many of the girls came to school without underwear. We were ready to give the mothers a lecture on this when one of them said, "Mahirap po ang buhay eh. Kung kayo po ang papipiliin, sa maliit po na halaga na meron kayo, saan niyo po gagamitin ang pera? Sa underwear o sa pagkain?" In the course of working closely with public schools, ACE realized how seriously malnutrition and hunger were affecting the school children. Malnutrition and hunger were among the top reasons behind frequent absenteeism and overall poor performance among many students. This realization prompted ACE to start in-school feeding programs in 2010 following a central kitchen model. We patterned this after the large-scale in-school feeding programs in India led by the Akshaya Patra Foundation. The first central kitchen was constructed in Manuel Quezon Elementary School, Quezon City, where meals were prepared for 4,000 children every school day, 1,000 children from each of 4 schools in the area. The initiative was called Blueplate for Better Learning Feeding Program and was implemented by ACE through the support of the 4 professional schools of Ateneo de Manila. Soon after, the program was replicated by governments such as Valenzuela City and Mercedes Camarines Norte. Gawad Kalinga also expanded the program in many places all over the country. Importantly, Ateneo de Manila's experience contributed to the masustansyang pagkain para sa Batang Pilipino Act, which was approved in July 2017. Through funding from the government, it became possible for undernourished public elementary school children to be provided one meal in school every school day. The beneficiaries in school feeding programs are referred to by the system as wasted or severely wasted children. ACE takes this to mean that unless effective interventions are undertaken, the undernourished children risk having wasted or severely wasted futures. The suspension of classes towards the end of last school year due to COVID-19 abruptly terminated the feeding programs. That was sad because for most of the beneficiaries, this was a meal they always looked forward to, their only decent meal for the day. Hunger is defined as an uncomfortable or painful sensation caused by insufficient or delayed consumption of food. It ranges from short-term physical discomfort to severe, life-threatening lack of food due to economic or other reasons. Chronic hunger makes a person unproductive in general, susceptible to recurring illnesses, and prone to developmental disabilities. Chronic food deprivation leads to a deficiency in critical diet-based micronutrients such as iron, iodine, and vitamin A. Severe deficiencies in these micronutrients can result in conditions such as blindness, low IQ, anemia, susceptibility to diseases, and even death. Chronic hunger causes stunting, a form of growth failure that develops in children and is often associated with cognitive impairments such as delayed psychomotor development, impaired brain function, and overall inability to achieve one's full potential. We know that the effects of stunting are devastating and irreversible. The questions I asked at the start of this session were questions used in the most recent survey on hunger conducted by the social weather stations through a national mobile survey. The results of the SWS survey, which were reported last September, showed that in the Philippines, the proportion of families experiencing involuntary hunger or hunger due to lack of food to eat at least once in the last 3 months has reached a new record high of 30.7% or an estimated 7.6 million households. Based on SWS surveys, this surpasses the previous record of 23.8% in March 2012. The proportion had been declining since 2012, with 8.8% recorded last December 2019, but unfortunately, COVID came. The pandemic has hit the poor so badly. Some projections indicate that globally, by the end of 2020, more people will die each day from hunger than from COVID-19. As soon as it became clear that schools will not open for face-to-face classes this school year, ACE shifted right away to food packs as an alternative to school meals. The food packs consist largely of vegetables, root crops, or fruits, guaranteed to have been harvested within the last 48 hours before these get to the beneficiaries. Each pack has around 4 to 5 kilos of healthy food and costs about 90 pesos per pack. Based on market or grocery prices, the value of these food packs is about 150 to 200 pesos per pack. We decided on 90 pesos because the initiative was initially intended as an alternative to school feeding, and the government's budget for school feeding is 18 pesos per child per day. That's 90 pesos per week. Unlike the school meals, which benefit only the children, the food packs also benefit their families. Some have argued that the initiative should only benefit the children involved. However, We think that while the pandemic is in our midst, this is the best way we can reach the hungry and malnourished children regularly and systematically. Including the other family members may not really be a bad idea. Besides, we know that in most families, the adults will sacrifice their own needs for the sake of the children. It would have been much easier and simpler to distribute rice rather than prepare vegetable packs. However, distributing rice would have perpetuated poor eating practices such as eating rice with instant noodles, hot dogs, fish balls, or other unhealthy food. Better nutrition for the beneficiaries, especially the children, is an important goal of the project. A recent study on the ACE school feeding programs conducted by Dr. Eden Miro and others revealed that the diet of public school children in Metro Manila greatly lacked vegetables and fruits, especially dark green leafy vegetables, vegetables and fruits rich in vitamin A, as well as legumes, nuts, and seeds. Hence, we are hoping that in addition to alleviating hunger among the beneficiaries, especially during this dreadful and distressing pandemic, the weekly provision of food packs will also facilitate dietary shifts that promote nutrition. Changing the eating habits of the beneficiaries, especially the adults, may be a challenge though, as they may already be used to unhealthy food given their circumstances. We would like to see this initiative influencing the most vulnerable in society to go for healthier and nutritious food. It is crucial that in the long term, healthy food is made more conveniently available and more appealing in terms of cost to the poor and vulnerable. The regularity and availability of nutritious food through these food packs during an extended period such as this pandemic can hopefully cause a sufficient transformation in the eating preferences and habits of the beneficiaries. If effort can be exerted to make vegetables, root crops, and fruits more easily available to those who need help the most, perhaps the beneficiaries will not go back to unhealthy eating habits even after the pandemic. Healthy eating, even among the poor and vulnerable, can become part of the new normal. Like the Blueplate for Better Learning feeding program, the immediate goal of the initiative is to address hunger and malnutrition among children at risk. But importantly, it also serves as an educational intervention. Through the food packs, we are hoping that the children will also be able to do well in their lessons. We want them to study and focus on their school tasks rather than worry about looking for food. By providing food to help the children complete their studies, we look towards ending hunger more permanently than temporarily. Just like poverty, hunger is a vicious cycle. The SWS had articulated that hunger was higher the lower the socio-economic status of the respondents. Hunger traps people in poverty. Poverty traps people in hunger. The cycle has to be ended. The cost of the food packs, 90 pesos per pack, is made possible through direct purchase of the contents from the farmers. The goal of helping farmers with their produce is an equally important component of the initiative. Through better prices for the produce, made possible by direct purchases from them rather than going through traders and middlemen, the long-term hope is for the farmers to be motivated to continue farming, improve their farming methods and practices, and get out of poverty. In a world where more than 800 million people are chronically hungry, the tendency may be to also assume shortage of food. But this is not the case. We know that there is enough food in the world to feed everyone. While millions of vulnerable people around the globe go without adequate food to meet their basic needs, the Global Food Banking Network reported in 2019 that approximately one-third of all food produced for human consumption, or 1.3 billion tons, is lost or wasted. Globally, vegetables, root crops, and fruits have the highest wastage rates of all food produced. We have seen this ourselves. In this initiative, farm produce that might have been lost or wasted have been redirected to those who need food the most. Since we started last June, we have already distributed over 15,000 food packs. We are currently providing food packs weekly to 1,300 school children and their families. Earlier, the principals reported that the enrollment figures significantly improved 3 weeks after the program started. Parents of the children shared with us during interviews that prior to this program, they had to limit themselves to 2 meals a day. Either they went straight to lunch and skipped breakfast or slept without dinner. For most of them, meals consisted of rice and salt, sugar, soy sauce, ketchup, or bagoong. True, give a man fish and you feed him for a day. Teach a man to fish and you feed him for a lifetime. However, with over 36 million hungry Filipinos in our midst today, it is urgent to extend whatever help we can. Majority of the 36 million are children, and no child deserves to go to bed hungry. No child should have to skip meals on Thursdays. No parent should experience intense stress and anxiety from uncertainty about where the next meal for the family will come from. No parent should have to let his or her little girl run around without underwear. Discussions on different levels have brought to the table numerous proposals on how to end hunger. People have cited poverty reduction, sustainable food production, climate resilience, access to credit, urban farming, access to education, social change, government intervention, empowering women, birth control education, and combinations of these solutions to combat hunger. The current initiative of ACE involves looking for 7.6 billion Filipinos who can spare 90 pesos weekly to provide food for 7.6 million households while the hunger situation is at life-threatening levels. Whether the situation is appealing to our sense of compassion, our interest in safety and security in our community, or our concern for the country's future, the current hunger situation should be everyone's business. The situation cannot be ignored. As we wait for a vaccine for COVID-19, we cannot look the other way and pretend the hunger crisis does not exist.